What's up, everybody? Dr. Ranen here. Today I'm with Coach Milosh. He comes in today with some general spinal pain, neck, mid-back, lower back. He's a personal coach here in Dubai, so he's obviously training a lot. He also has a amateur combat sports background. So we're going to assess him, see what we can find, and see how we can help him. All right? Remember, please hit the subscribe button. You don't want to miss out on our unique content. Okay? All right. Everything seems to be working down there. Great. Hands on your hips for me, please. Okay. Can you feel this?
Yeah.
Same both sides?
Same.
Here.
Same.
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 Hands, please. Can you feel that?
Yep.
Here. Here.
No, same for now.
Same.
Same.
All right. So you may be asking, why am I doing a full neurologic examination when Milosh is not necessarily presenting with any neurologic symptoms or any nerve compression syndrome? Musculoskeletal pain or any pain in the body can very easily manifest with neurologic symptoms or weakness, change in reflex, and loss of sensation. Sometimes patients don't even realize that they have it until we test for it. So it's always good to start here and then make your way through. It's part of doing a good, sound diagnostic testing. Let's get you to lift your toes up for me, please. Push up. Good. Push up. Good. Push down. Push. Great. Push down. Great. Lift your feet up for me. Push up. Good. Down. Good. Up. Good. Down. Good. Push forward. Good. Push back. Good. Forward. Good. Back. Good. Okay. Squeeze for me, please. Squeeze. Good. Lift your fingers up. Push up. Good. Make a fist for me. Lift up. Push up.
Up.
Yep. The side. Let's go. Good. Turn your hands over. Lift your fingers or wrists up. Push up.
Up. Yeah.
Yes. Good. The side. Good. Make a fist for me. Push your wrist over or turn over. Go. Good. In. Good. Over. Good. In. Good. Up for me. Good. Up. Good. Down. Great. Up for me. Good. Up. Good. And down. Great. All right. We're almost done with that. Let's get you to sit up for me. Hold. Bring your thumb in. Push up for me. Good. This side. Hold. Push up for me. Good. Relax. Okay. So, you've been having more right-sided neck pain, correct?
Yep.
Okay. Let's get you to look up for me. Any pain?
No.
Look forward. All right. Turn your head to the left for me. Any pain?
No.
Turn your head to the right. Any pain?
Nothing.
All right. Bend your left ear to your left shoulder. Any pain?
No.
No. Okay. Right ear to right shoulder. Any pain?
No.
Okay. Now let me try. Any pain?
No.
Okay. Any pain?
A little bit of stiffness on the right, but
On
no,
the right
no
side.
pain.
Okay.
Yeah.
Any pain?
No.
Sorry. Any pain?
All good.
Okay. here.
Now until the end, a little bit of tension on the
On
left
the
side.
left side, okay. Here,
Yep, a little bit here.
tension, okay. Any pain when I do that?
A little bit.
Where about?
It's on the low,
Okay.
low neck, yeah.
When I push down?
In this position, no.
Okay. Leave your head loose, okay? If I do that, do you have any discomfort in the neck?
Same place, but on the left,
On the
side,
left
like
side.
the previous.
Okay. If I push down?
A little bit here,
A
yeah.
little, okay.
This.
Sit upright for me. Great. So let's test out your traps. Push back for me, please. Push. Good. Up for me. Push back. Good. This side. Push back for me. Not bad. Push back for me. Not bad at all. Okay. Cross your arms for me, please. Hug yourself.
Like this?
Yeah. Let me give me this arm. There we go.
Uh-huh.
Cross. There we go. Right. Turn to the right for me, please. Your upper body. Yes. There we go. Back to neutral. Turn to the left. Any stiffness or pain?
No.
Do you feel like you can turn to the right more?
I feel I can turn, but yeah, only a little bit might be stiffness,
Stiffness
here.
in the mid back.
Yeah, but the rest is just
Okay.
fine.
Okay. Sit upright here. Bend to the left for me. Any discomfort?
Yeah, a little bit in the lower back on the left
Lower
side.
back.
Left side.
Okay. Right side.
Right is good.
Right is good. Okay. When I turn you to the left, or when you turn to the left, do you feel discomfort here on the left side?
A little bit, yeah.
And when you turn to the right, do you feel anything on the right side?
On the right, no.
No. Okay. Okay, keep your arms crossed for me. Let me move you. When I move you, better on the left or still tight?
No, no, it's good. Okay.
It's good.
When you
Okay.
put a bit of pressure, it's good.
Yeah.
Yeah, same.
Okay. Leave your body loose for me.
Okay.
Feel a bit tight there?
Yeah. This part exactly where you're pressing now. This is
Yeah.
the tension where I have.
Okay. You are quite a bit taller than me. I have to lower this bed a little bit. All right. Again for me.
Yeah.
Great. Okay. Leave it loose here.
Okay. Mm-hmm.
Ooh, got a nice pop there. Okay. Let's try this side. Ooh, leave it loose, leave it loose. Feel a little bit tighter here.
Yeah. Left side is a bit tighter.
Right side feels a little tighter. Okay. Let's get you to stand for me, please. I'm gonna face that way.
Okay.
Okay. Any pain here?
Not for now.
Any pain there?
No, a bit of
No?
tightness in the lower,
middle
but
back,
yeah,
okay.
mid, but not no pain.
Here?
Here, no. Here is good.
Okay. Here?
All good.
Here?
All well.
Oh well. Okay, let's get you to bend forward for me.
Back straight,
Yes.
or you wanna bend?
Yeah, bend for me. Just like that. There we go. Any pain in the lower back?
No.
No. Okay, great. Take a seat for me, please. Straighten your right leg. Point your toes towards you. Drop your chin down. Slouch forward.
Like this.
Yes. Any pain in the lower back or stretching in the
No,
leg?
no, just tension on the hamstrings, but
Okay,
lower back.
relax for me. Sit upright. Same on the left side for me, please. Toes towards you, chin down. Any pain in the lower back, stretching in the leg? Nothing.
On
Tension in the hamstring. On your back for me, please.
This way.
Yes, please. Oh, Hamstrings are quite tight, eh?
Yeah, yeah, yeah.
Your left leg feels way more tighter though, compared to your right side.
Possible.
Look at that. Let's try this out. Leave it loose.
Okay.
Get to 70 degrees and it becomes quite tight. When you look at this side, much more flexible. Leave it loose. Look at that. Way better. Okay. Hold for me. Have you had a hamstring injury on that side before?
No, but it might be from kickboxing as well because of kicks and stuff.
Are you southpaw or orthodox?
No, I'm orthodox, but from tipping, you know, from the
Okay,
kicks.
T kicks.
Yeah.
Okay. Lift your leg for me. Hold. Push up. Good. Turn your foot out. Push across.
This way?
Yes. Good. Push inward. Good. Relax. Keep your knee in this position and then push in for me.
Inside?
Go. Yes. Good. Relax. All right. Let's try this side. Lift up for me. Hold. Push up. Ooh. Not so good, eh?
Yeah, you feel it here.
Yeah, let's try again. Yep, not so good. Lift up for me. Turn your foot out. Push diagonally now. No, turn your foot out. There we go, yes.
Up or side?
Yes. Yes, there we go. Just like that. Go. It's not bad. Could be slightly better. Push in for me. Go slow so you don't hurt yourself, right?
Okay.
Because this side is a little bit weaker. Go. As I get stronger, you get stronger. Okay, not bad. So that's your adductor magnus, and this is your adductor longus now. Sorry, that was your adductor longus. This is your adductor magnus. Keep your knee in this position. Push across for me. Good. Okay. So your quad isn't working as well as it should, eh? Push across for me. Keep your elbow straight. Yeah. Good. Push towards your hip.
Towards the hip?
Yes, go. Great. So, this is your pec. So we're just continuing our muscle testing. Push across for me. Go. Not bad. Come down. Push towards your hip. Good. All right. Let me grab this from you. Let's get you face down, please. All right. So we have a slight leg length inequality here, and you can see that the left leg is shorter. It's also the one with the weaker hamstring. So we're gonna check what's going on here. Can you contract your hamstring for me, please? Slowly. Start slowly. Okay, go. Great. This test is glute out. Lift up. Hold. Push up for me. Good. Relax. All right. Slowly, slowly. Let's go. Relax. Okay. I want you to watch something here. Watch the hip. As you start to contract the hamstring, feel what happens with your hip. Go. Go. Go, go, go. See how you lift up here. Yeah. Okay.
Weaker.
Yes, it's weaker. Lift up. Hold. Push up. Yeah, look at that glute. Okay. Not working as well as it should. Okay. All right. So let's get you to raise your right leg from your hip for me, please.
From the hip?
Yes,
Like
right
this?
leg. Yes. Up for me. High as you can go. And down. Left leg. Good. Okay. Sensitive here.
Not that much.
If I push here.
It's okay.
It's okay? Okay. If I push here,
No, for now it's okay.
okay. Sensitive there?
A little bit, yeah.
Let's try that again. Compare this side to this side. Which one's more sensitive?
Right side. is a
Right
little
side.
bit.
Okay, there we go. Sensitive here. It's okay.
Yeah, yeah.
Here. Let me grab my pen again.
This is sensitive.
This one here, eh?
This is
Yeah. So, we know where we are by using bony landmarks. So the bottom of the shoulder blade here and here is T7. So that's T7. That's about T6. That's about T5.
This one is
Yeah.
painful, yeah.
There we go. T4, T3, T2. Okay. Right here.
Yeah, this is pain.
There we go. Okay. Sensitive, not so much. Sensitive
Not that much.
here. That
Not a lot.
not a lot. Okay. And let's have a feel here. Oh, your traps are quite tight, eh? Which side's more sensitive, here or here?
And this moment, right side. is
Right
more
side.
sensitive, yeah.
Okay. Drop your chin for me, please. Drop your chin a little bit. Okay. Which side is more sensitive? Left,
Now left. The way you press is left.
here,
Yeah. This one I feel tightness, but here it's more.
more sensitive.
Yeah, the left is more.
Okay. Okay, guys. So we've done some testing. We have all our information. Now we're going to go ahead and treat Milosh. We're going to do some manipulation of the sacroiliac joint, the lower back, the mid back, and neck. We're going to reassess him and see how he feels. All right. Let's get you to come slightly down for me, please. There we go. Bring up your right hand for me under your hip. There we go. You good?
Yeah, I'm asking about the left one.
Turn your head to the left for me, please. Yes. There we go. Relax that shoulder. Inhale and exhale. Leave that shoulder loose. Exhale, exhale. Oh, there we go. Small one. Face down for me, please. Hand back to normal, neutral. Inhale and exhale all the way out. Inhale and exhale all the way out. Nice. You good?
Yeah, all good, all good.
All right. Let's get you on your side for me, please. Any side is fine. Come to the edge for me. Bend your bottom leg. Bend your bottom leg. Okay. Give me this hand. Let's pull you through. There we go. Oops. Okay. Relax, relax. I'll move you, okay?
Okay, okay.
Look up. There we go. Roll this hip forward. Roll, roll, roll. Okay, great. Inhale and exhale all the way out. As you exhale, leave your body loose. There we go. You good? Let's get you to turn the other way.
Like this?
Yeah, on your side, on your side. I'll set you up. Okay, there we go. In this hand. Okay. Place that hand there. Great. Look up for me. Let this foot. There we go. Inhale. Exhale all the way out. You good? Great. On your back for me, please. Let me get this from you. Drop your head down. Inhale. Exhale. Leave your head loose. You good? All right. Let's get you to sit for me, please. Okay, on your back. Lie back for me. Great. Give me a second. Okay, let's get this done. So this is your right side. Lift your head for me, please. Right side felt tighter. Let's get this up. Okay. Inhale. Exhale. Ooh, there we go.
Okay.
Inhale. Exhale. Oh. Bend your knee for me, please. Bend your knees. Okay, let's go one more time. Lift your head. All right. Leave your body loose. I'll move you, okay? There we go. Inhale. Exhale. Hold. One more time. Inhale. Exhale. Oh, that went. There we go. All right. Let's get you up. Okay. Okay, let's retest this side. Leave your leg loose. Look at that.
Much better.
Much better. Okay, hold for me. Push up. Nice. There we go. Let's get you face down, please. We will check your leg length, check your hamstring and glute. There we go. Equal. Let's get you to raise your right leg from your hip for me, please. Great. And down. Left leg. Great. Equal. Let's check your hamstring strength. All right. Contract, contract, relax. Okay. So there's still a little bit of inhibition here. You can see how Milosh rolls the hip slightly, ever so slightly, to get the maximum out of the hamstring. Let's test the glute. Lift for me and hold. Push up, push. Look at that, much better. So he's getting some hip extension now as well. Okay, let's get you to sit for me, please. Okay, cross your arms for me.
Like this?
Let's get you to rotate to the right for me, please, as far as you can go. Much better. Any sensitivity on the right side?
No.
No? Turn to the left for me, please. Much better. Any sensitivity here? No. Relax. Okay. How's that?
All
Good?
Yeah, yeah.
Any sensitivity here?
No.
How does it feel on the right side?
No tension.
Good?
No tension at all.
Here?
Yeah, good.
Great. Here, any tension on the left side? No?
Nothing,
Okay.
nothing.
When I do that,
No more pinching, yeah.
no more tension. Great. And here. Great. Okay. Okay, guys, that brings an end to our session today. You can see I am sweating. It's a lot of hard work to move a guy of this size. I'm a big guy. He's bigger than me. It takes a lot of hard work. We were able to find a few areas of dysfunction, correct them, reassess Milosh. He's in a much better position now, and he's going to find that he's less prone to injury or aches and pains now with his training. So do you want to let our viewers and the subscribers know where they can find you on social media?
Absolutely. You can find me on Instagram, coachmilos.dxb.
All right. Okay, guys, that brings an end to our session today. We hope to see you soon. Make sure to like, subscribe, and hit the notification button. Cheers.